Let's be honest, if you're dealing with low back pain, it sucks. So in this video, what we're going to show you is exactly what we do here at Deep Roots Health Center in order to help out our patients with low back pain. So we're going to demonstrate something called the lumbar Denneroll, which actually works on the overall curvature of the spine. And this is something that we do right here in our Bentonville practice, just south of Rainbow Curve. So what I want to show you real quick is actually what that spine looks like on the inside and why something like this is so important. So with your spine from the front, of course what you want is that that spine is nice and straight. Most people know that, but from the side, what you might not be aware of is that we actually want 3 different curves. We need one in the neck, we need one in the mid-back, and also one in the low back. What that does is it gives you your shock absorption and your ability to resist gravity. But what happens is there's a lot of people that actually have an abnormal curvature in that low back. And a large part of it is due to our normal body positions. You know, we're sitting at work, we're maybe sitting in the car driving to work and from work, and then we get home and we sit in the recliner, right? We're always sitting. There was actually a Time magazine cover that came out a few years ago and it said sitting is the new smoking. Nice. So we're gonna make sure that we're taking a look at the curvature of the spine and getting it on point. So what we want is about a 45-degree curve. So if it's a decreased curve, like this one is right here, this is going to be especially important. But this is also valuable for a curve that's increased as well and has too much curvature, because that's going to put pressure on all those nerves here in that low back, which is not good because that's ultimately going to affect all those muscles in that region, which causes things like low back pain. So I'm going to have Segan demonstrate what that looks like. So Segan, you're going to lie on top of that Denneroll. And what this does is it's actually working to put that curve back in her low back. So, you know, if the patient has a decreased curve in that low back, this position is going to be super valuable for it. And this is the one that we're going to demonstrate for you because this is what most cases are like. But as you lie on top of that, you can see it poking out the side here. It works to put that curve right back in that low back. And it's something that you can do easily at home. But the cool thing about this is it's specific to each patient. So there's different sizes that we can order in order to make sure that you're getting the superior fit for your spine. So Segan's just going to hang out right here and honestly get her care in for the day. But that's honestly what it does. It works to put that curve back in and take pressure off the low back. If you'd like to get fit for your Denneroll, I'd be happy to help you out with that. Our practice is, again, just south of Rainbow Curve, and we actually have a special offer going on right now for our low back and other patients that are dealing with other problems. It is just $40, and it includes an exam, a consultation, any necessary x-rays or other testing that we need to do. So in order to take advantage of that, just click on that button below. It'll bring you to a separate page where we can start that conversation and go ahead and get you scheduled for that appointment. So looking forward to taking care of you in the office, and we'll see you real soon.